And you're only measuring from the 6% that's in the interstitium and the blood. Tiny changes in the blood reflect huge changes in the cells. Feeding I'll talk about next. Get out of there. We know. You have to keep their weight up. You can slow the progression of disease if you can maintain their weight. That's incredibly important. Weight loss is associated with decreased survival, and weight loss begins 1 to 3 years before the diagnosis of chronic kidney disease. If your clients were to buy one piece of equipment for their cat, I would recommend a baby scale. That they have a baby scale at home, and once a month they weigh their cat and they write it down. Okay, sorry, get out of there. What meds do we use? Well, anemia. With hyperphosphatemia, we want to, I'll talk more about hyperphosphatemia when I talk about diet. I'm already into that lecture time. Anemia, we're thinking about darbepoetin, and erythropoietin. So erythropoietin, but you might develop anti-EPO antibodies, so we're using darbepoetin. It's less antigenic. We dose it once a week. And now what's become available in some parts of the world, I don't know whether you have it here yet, is Varenicline. It's Meligostat, and it's really an interesting thing where you are using an inhibitor to hypoxia-inducible factor propyl hydroxylase. Anyways, there's you can see the product insert. Some cats will need transfusions, regardless. If you are going to think about doing transfusions, the ISFM's got some lovely guidelines on collection and administration of blood and blood products in cats. 2 weekends ago, I was in Sao Paulo in Brazil, and they do blood transfusions all the time. It's really interesting, and they have blood banks for cats. So antioxidants in kidney disease, there's not enough. There simply isn't enough research on these products. We have no idea how they work or not. Summary of this, I'm already more than 4 minutes into the second slot. Determine the IRS stage when they're hydrated, evaluate for hypertension. If they have an increased urinary protein and the urine sediment is clean, then do a UPC, hydrate and maintain hydration, and then treat specific etiologies if you identify them, monitor, measure, and reassess. Remember, these are the things that make a difference. Darbepoetin should be used. Amlodipine or telmisartan are useful for hypertension. Benazepril or telmisartan are useful for proteinuria. This is where you want to be getting to. There's some updates this year, but essentially, and again, you will see this summary that I've put together here for stage 1, what you want to do for stage 2, for stage 3, and for stage 4. But above all, we're looking for quality of life, which means we have to be talking about food. Now, one last slide I want to show you on this, and that is some good resources, and namely, this book for clients is fantastic. You can get it as a PDF, or you can get it as a book from catprofessional.com. A really useful book, catprofessional.com, and then the IRS-kidney.com website, and then the other things. There's some things about ACGAM guidelines. Now, I'm going to quickly get out of here. We can do questions at the coffee break, and I need to right here get into this one. Here we go. So feeding cats with chronic kidney disease. Cats aren't dogs. With dogs with kidney disease, they drop dead a lot faster. Cats with chronic kidney disease, we're talking about them living 6 to 10 years in general after the time we diagnose them with chronic kidney disease because we're screening for it. Okay? So it's very different. They live a long time. It's typically a slow progression. It's tubular interstitial inflammation and fibrosis, not glomerular sclerosis. So I've talked all here about all these different non-specifics, the role of the importance of hydration. Can't emphasize that too much. And come on, give me my cursor. Here we go. We just skip that. So Talked about metabolic acidosis a little bit. We need to aggressively correct that. Again, hydration on that. Talked about hypokalemia, really important. Okay, feeding them. They've got to get enough calories. I mentioned the fact that that being in poor condition means that they are not going to live as long. So we have to make sure that they are neither inappetent nor nauseous. So we're going to use mirtazapine, meropenem, or ondansetron for their nausea and vomiting. Okay, you guys have those. Metoclopramide, as Terry mentioned yesterday morning, Dr. Fossum mentioned yesterday morning, metoclopramide doesn't work in cats. Okay, it's not an antiemetic. She was actually talking about with dogs with GDV. It actually is only a pro-motility agent, and it's not very useful. Cats don't really get uremic when they get uremic gastritis, they get fibrosis. They don't ulcerate the way we do or dogs do. They get fibrosis. So what we want to use for the nausea, and these are for vomiting, would be an H2 receptor antagonist, or better still, a proton pump inhibitor. But we need to be careful. We don't want to be using these gastrointestinal protectants for a long term, because that can also cause problems and cause rebound. So we need to be very careful of that. But let's say we've got them, they're no longer nauseous thanks to the drugs we're using, and because we've got them rehydrated. What should we be feeding them? So the idea of protein restriction has been with us for a really long time, and the idea of protein restriction comes from rats and dogs. Rats and dogs. We have just again assumed that cats are either big rats or small dogs, and just gone across with that. There's a theory that in rats it decreases glomerular capillary pressure. There's no evidence that benefits cats. But we do want to try to reduce the nitrogen excretion burden on the kidneys and maintain, or better still, increase GFR, which is why it's so important not to use, if we're using drugs that could potentially decrease GFR, such as treating hypertension, we have to monitor and make sure that we don't decrease GFR. The other thing, too, is if you think about nitrogen excretion burden, which they get from like protein in diets, and like protein and amino acids, they generate nitrogen. So do the amino acids. If somebody's not getting it, cats are protein obligate carnivores. They need protein. And if they don't get it from the food in the bowl, they've got two options. They either die or they take it from their muscle. So if they take it from their muscle, which is why they become so thin, and if they take it from their muscle, they end up still having to digest that, so they still have a high nitrogen burden. So therefore, restricting protein in their diet may not be beneficial. We want to, however, decrease phosphorus. Decreasing phosphorus is the other reason that we restrict protein, because the phosphorus generally comes from the protein. So as I said yesterday, and you very correctly said, a cat is none of these species. So we look at where the information came from. It's been a dietary cornerstone for a long time. If we look at naturally occurring stable chronic kidney disease, rather than remnant kidney models and all kinds of other things like that, there was a very good study by Sherry Ross in 2006 that said, where she found that cats being fed Hill's KD, kidney diet, as opposed to a maintenance diet, that they lived longer and they had fewer uremic episodes and fewer renal-related deaths. But she said individually or in combination, similar dietary modifications in the present study may have minimized the number of uremic crises and mortality rate. We don't know that it was the protein restriction that did it. We don't know that. So we've seen some benefit from these diets, but with these diets, what we're really looking at, renal diets, they're not just protein restricted. Whether it's made by Royal Canin, whether it's made by Purina, whether it's made by Hills or some other company, they should be more than that. They should, in fact, have reduced phosphorus. They don't need reduced sodium. It can be stable or increased. They're alkalinizing, they have more potassium, omega-3 fatty acids against inflammation. They're more calorically dense because we know these cats have a lower appetite and we need to get more calories into them. And some of them have increased fiber, increased B vitamins, etc. What do we have for increased phosphorus? Again, remnant kidney model, not naturally occurring disease. Remnant kidney model means you take a perfectly healthy young cat, you yank out one kidney, you yank out 2/3 of the other kidney, you wake them up and you follow the cat and see how they do. Okay? And they found that controlling phosphorus modulates PTH and FGF23. Are you measuring FGF23s? Is that something that's available for you? Not yet. Really useful. Keep your eyes open for that. They had less pathology, they had less morbidity and mortality. They found that restricting phosphorus arrested the progression of chronic kidney disease in rats, regardless of dietary protein levels. So maybe instead of restricting protein, we need to restrict the phosphorus independently by using intestinal phosphate binders or something else. So let's see, bottom line on this is that and hyperphosphatemia is a bad thing because of course it causes soft tissue mineralization, so mineral bone disease, previously known as renal secondary hyperparathyroidism. So we want to be careful of that. Now, FGF23, measuring it may help to identify cats who would benefit from dietary phosphorus restriction. Why? Because you remember with phosphorus, if phosphorus levels go up, PTH level, or phosphorus levels go up, PTH levels actually go up before the phosphorus levels go up to try to modulate the calcium, because you have to have that calcium-phosphorus balance. So you can actually predict who's going to have problems with the phosphorus if you measure PTH. Because that came before. The problem with that is PTH is an expensive test. But what comes before PTH is FGF23. And FGF23 is not an expensive test. And FGF23 predicts from earlier whether you're going to run into trouble with phosphorus. So that's why measuring FGF23 can help identify cats who would benefit from phosphorus restriction where the plasma phosphate is in the target, even if the plasma phosphate's in the target range. You have to monitor the calcium as well, because if the total calcium is too high, then you need to give them a less phosphate-restricted diet, because it's all about the balance there. Okay, so talk here about the need for, I didn't really talk a lot about metabolic acidosis, so we want to alkalinize. And acidosis promotes protein catabolism, it decreases protein synthesis, it results in loss of lean body mass, which is bad, increases calcium, which is bad, you're going to get bone soft tissue mineralization, and it causes potassium excretion, potassium loss. And in people, just by correcting acid-base imbalance, they get clinical improvement, just by doing that. The nausea, vomiting, etc. reduces, there's less loss of lean body mass, and it may slow the progression of chronic kidney disease. So we lack data for cats, but it's assumed. A lot of this stuff is just assumed from other species or from remnant kidney models. With potassium also, the data that we've got is pretty flimsy, but we do know that acidosis exacerbates hyperkalemia. We know that hypokalemia can cause chronic kidney disease, and chronic kidney disease causes hypokalemia, so it's a bad thing. We know that potassium supplementation helps to reduce creatinine levels, so it's but we have hardly any data there. What about other nutrients? Well, sodium, we have no evidence of benefit for cats. Alkalinizing buffers, we lack data. Potassium, we lack power. Omega-3 fatty acids, there's weak evidence. So it's a lot of this stuff is dog, rat, human. Okay, so what is the evidence that protein restriction is beneficial? What do we have? Pathophysiologic reasoning, extrapolation from other species, observations from renal ablation, and only a few trials of naturally occurring disease. So I'm not going to go through all of that, because that's, we don't have time, and that's pretty theoretical. What I am going to say isn't low protein the holy grail for chronic kidney disease? Does protein cause uremia? Not on its own. Protein is, as I said, protein metabolism is not just from the food that you're eating with the protein in it, but it's also from stored protein. There's more than 60 uremic toxins you can see, or maybe you can't see because it's too small. SDMA, urea, creatinine, where is creatinine? Somewhere here. There's all these different things that are uremic toxins. It's not just protein. It's not just or creatinine. Additionally, remember that there's not just one type of kidney disease, not just one cause. Also, inflammation and malnutrition, can cause uremia. So if malnutrition causes uremia, then you've got a dog chase tail or cat chase tail type scenario, and there's non-nutritional toxins as well. So we don't, with the studies that we have for protein restriction, we can't do meta-analysis. The studies are far too different. They're too different, the numbers are too small, and so we really don't have data. We don't have data. But if you step back and look at the bigger picture, who and what is a cat? How have they been designed? What have they been designed to eat? Remember, 52% of their energy comes from protein. 52% of their energy comes from protein. They're obligatory carnivores. They've evolved to manage a high protein load. They can cope with restricted protein as long as minimal requirements are met. And those minimal requirements in the good prescription diets for kidney disease, absolutely they meet their minimal requirements, but some cats need more. Because as cats get old, one of the reasons cats get overweight is their maintenance energy requirements decrease as they get older. So from kitten to 11 years of age, just like dogs, just like us, the older we get, the more prone we are to becoming obese because our metabolic energy requirements decrease. But cats are different. After 11, their metabolic energy requirements actually increase. That's why so many of our old cats are actually underweight rather than overweight. Additionally, they have digestive changes. They are no longer as able to digest fat or as able to digest protein. So that's why we need to have proteins that are extremely metabolically available, biologically available, and we need to make sure that we muscle condition score them. So there's some evidence, although with some people it's still controversial, that protein requirements increase in older cats because they have decreased appetite due to pain, altered senses, etc., decreased ability to digest nutrients. They may have catabolic disease. Some are prone to sarcopenia. So we need to be cautious with that. Every visit you see a cat, every time you see a cat, you need to do a nutritional assessment. Sounds really boring, it sounds like it takes time and it's tedious and we don't have time for it, yada, yada, yada. But at every visit, we want to get a diet history. Simple way you can do it is get the client to fill in the diet history form and you look it over. Or you send it to them ahead of time electronically. This is from the WSAVA Global Nutrition Guidelines, which is on wsava.org. Comes in a variety of different languages, which is helpful as well. We want to find out not just what they're eating, but how much they're eating of it. We've got to get clients to weigh the food, And remember, like you assume that they're still feeding the same thing, except they read on the internet, their friends saw on TikTok, their aunt's cat, blah, blah, blah. And so they've gone and changed the diet, and they haven't told you. Okay, so you have to ask every time. What is Fluffy eating now? Please tell me what Fluffy is eating now. Rather than saying, is Fluffy still eating X? Because if X was something you had recommended before and they've changed it, they may feel embarrassed and say, oh yes. So you need to use an open-ended question. What is Fluffy eating? Okay? And how much is Fluffy eating? And cats can be extremely, extremely picky. They may like the loaf type things. They may like the shredded. They may like the chunks. They may like big food. They may like small round ones. They may like star-shaped ones. It's really crazy. And also when gravy, the brown liquidy stuff that's on many of these foods, if that's all the cat's licking and they're not eating actually the food itself, that's insufficient because gravy is just carbohydrates, right? It's just flour and brown stuff, right? There's no nutrients in there other than some carbohydrates. So we need to get a diet history. We've got to get a body weight. Come on, that's the easiest thing in the world. Just get a body weight and record it. We also want to get a percentage weight change. Because percentage weight change, again, now we're talking about trends, and the nice thing about percentage weight change is it will help you pick up gradual increases as well as gradual decreases, so that you can step in and make changes to prevent obesity or weight loss. Subtle changes and trends. What is a percentage weight change, you ask? It is simply, we're comparing to previous, so previous is on the top and the bottom of the equation, so previous is on the top and the bottom, and you subtract the previous from the current. It may be negative or positive, doesn't matter. Divide it by the previous, multiply by 100, and now you have a percentage weight change. So for instance, so I've got weight and percentage weight change. Weight, percentage weight change, let's say Kat was 4.5 before, therefore it's on the top and the bottom. And I take today the Kat's 4. Well, you and I know that that's huge, half a kilo in a 4.5 kilo cat. Okay, that's a huge amount. If they were, that's an 11% decrease. Now, if somebody doesn't go, ooh, 11%, that seems like a lot, I multiply it by my weight, and I tell them that's 7 kilos, or 16 pounds on me, and they'd be going, because they can relate to that, rather than half a kilo. So that's a useful thing to do. We also must do body composition measures, so body condition scoring and muscle condition scoring. How many of you are doing body condition scoring? Okay, let's work those arms. How many of you are doing body condition scoring? Thank you. Okay, about maybe 10% of you. 8, really important to do. Anybody doing muscle condition scoring? Even fewer. Okay, Glenn, when I talk to you next, you're going to be muscle condition scoring. Okay, so resources, and I'm going to talk to you about this in a second. There's the Pet Nutrition Assessment, which is a nice thing on YouTube that you can watch, getting screening, evaluation, history, physical exam, including weight, body condition scoring, muscle condition scoring. I include percentage weight change and nutritional recommendation. So those are some things. There's some things you can use. Now, let me just get to here. Anytime you are sending home or making nutritional recommendations, you are making a prescription. So we need to calculate the actual amount for the client and record it in a medical record, so the calories that they need. Then we're going to convert that into how many grams of food that is. How many grams of food. We have to communicate specific amounts and specific diets. And ideally, we want them to weigh it. This was from a really nice webinar that I watched in May of last year, I guess. Clients who receive clear healthcare recommendations were 7 times more likely to adhere compared to clients receiving ambiguous recommendations, such as, just look for a good quality diet. Too vague. Those supplements aren't likely to hurt anything. I have a real problem with that. The reason being that it's they can't do any harm. Yes, they can. Not the product itself, but rather people come into your clinic with 4 budgets. One of them is money. One of them is emotional. How much emotional distress they can handle with pilling or medicating or messing with their cat. Okay. The third one is time. If you're a single mom and you're working 16 jobs or whatever, you get the picture. Okay? You don't have time to be doing this and chasing the cat and getting the kids ready for school and soccer and all these other things. And the fourth one is ability. They may not physically be able to do all these things. So when you say, well, it can't do any harm, if money and time, if they can find emotion, they can only do one thing, I would rather that I do the thing that we know has scientific evidence rather than something that may or may not help. Okay? Just look for foods with meat at the top of the ingredient list. Not enough. We need to be specific. We need to be specific, and there's evidence for that. What evidence do we have for the importance of maintaining body condition? Weight and muscle loss is a normal age-related change due to those things I've already mentioned, possibly increasing need for protein and other calories. Maintaining weight and condition prolongs life. Frailty kills. Frailty kills. We all know it from the old people in our lives. Somebody who's really frail, they fall, they break something, they have to go to the hospital to have it repaired. They come out either with dementia or with a hospital-borne infection that kills them. Okay, so frailty is a real problem. So with frailty, that's due to cachexia, sarcopenia, frailty. They all result in lean muscle loss and death. And so here's just an image to show that from Dottie LaFlamme and Lisa Freeman. Weight loss is an early sign of chronic kidney disease. Remember I said it begins 3 years before the diagnosis. So baby scale is a really good thing. Cancer, another paper showed cancer, renal disease, and hyperthyroidism. Weight loss began 2.5 years before death. Other diseases, cardiac disease, for instance, and weight loss began almost 4 years before death. So get clients to weigh their CAPs. All right, so body and muscle condition scoring. This is the other thing I really want you to take home from here. Start doing this. The WSAVA.org has all these images. The ideal weight, whether some companies like using 1 to 5, some of them use 1 to 9. Regardless, it ends up here. You can see 5 images, but 9 numbers. This is the ideal body weight from the side and from above, and or body condition, I should say. And what that reflects is the right amount of calories. If you get too many calories, you end up on the right side. If you get too few calories, you end up on the left side. Okay, the right amount of calories, the correct amount of calories is the middle. But that doesn't tell you where the calories come from or how you're spending them. For that, you need muscle condition scoring. So muscle condition scoring is on the bottom right because it looks at protein. Okay, protein. And that what we're looking at here is and you're already sort of subconsciously doing this when you stroke a cat over the head. You're checking the muscle mass over the temporal region. Okay, and then when the cat lets you stroke them otherwise, you're stroking down the back and you're feeling if it's like piano keys or if there's nice epaxial muscles there or not. And you're also looking and you're feeling over the scapulae and the ribs. And you're also seeing that line in the sunken thigh or not. Okay, so those are all things that you can see in these images. Normal muscle mass, mild loss, and it's just a moderate loss, and severe loss. Okay, so in those regions. Now, the way that I'm going to get, let's see, where are we here now? The reason we've got to do that muscle condition score is because you could have somebody who's really chubby, who's got too many calories on board, but not enough muscle. And that's called sarcopenic obesity or overcoat syndrome. And if all you do is you look at the weight and the body condition score, that, like if somebody tells me, oh, my cat's 8 pounds or whatever, my cat's 8 pounds, are they overweight? I don't know. Unless I see your cat and body condition score them, I haven't a clue. Overweight, if they're Singaporean, yeah, they're obese. If it's a Maine Coon, they're emaciated. I have no idea. So body condition scoring is really important. Or muscle condition scoring as well. Where do I have it here? Oh, it's in the next presentation. So let me just show this to you right now. So muscle condition scoring, I'll just won't show it later on. This is how you're going to muscle condition score. Lift up your hand, please. Lift up your hand, please. Run your finger down this part of your hand. Okay, when you run your finger, run your finger down this part of your hand. That is slightly overweight or normal. Okay? If you turn your hand over, and run your hand down your flat hand, down your fingers down your knuckles. That is okay to mild muscle loss. Bend your hand like this. Run your hands, not a fist, just partly. That's moderate muscle loss. Make a fist, that's severe muscle loss. So normal, mild, moderate, severe. Can you do that? Yeah, easy peasy. Oh, so awesome. That's great. Okay, so how about calculating energy, the calorie requirements? Okay, zip it. Wait. Okay, so energy requirement calculations. Oh God, do we really have to do this? It's easy. This whole body weight, the resting energy requirement stuff, this is actually easy. Yeah, you guys all have one of these things. Everybody got a phone? Okay, so when you get your calculator function, go to your phone. Open your calculator. It shows you a whole lot of nothing useful, right? Turn it sideways. Now it's useful, okay? So when you do the body weight raised to the power of 0.75, let's say the cat ideally is weighing 4 kilos. What you put in is you've got 4. You type in 4. You type in 4, and then you touch the x to the power of y. Everybody find that on their phones, the x to the power of y, and you type in 0.75 equals. Ooh. And now you go times 70. Ooh. Now you have the resting energy requirement. Was that hard? No. You can all do that. Okay, and then you use, for your metabolic energy requirement, you take your RER times life stage factor, and here's a list of those. But there you go. There's your how to do it. Super easy. Or, how many of you are on VIN, Veterinary Information Network? Anybody on VIN? Oh, that few. Okay, that's interesting. So on VIN, you can go to Vindex. On Vindex, you go to calculators and conversions, which gives you a whole bunch of these things. I've only cut a picture of some of them. Energy requirements. You go to energy requirements, you put in that it's a cat, you put in their weight and whether you're using kilograms or pounds. You put in, I put in kilos, and that they're a growing kitten, and then I calculate, and I tell them what the energy content of the food is. This is super easy, what the energy content of the food is, and it will tell me the energy requirement as well as how much they should be drinking. Okay, so really useful thing if you've got VIN. But it's not just the calories. Old cats need a lot more. Old thin cats need 70 kcal per kilogram per day, as opposed to the raised to the power of 0.75 and then the whole thing times 70, which is approximately 50 kcal per kilogram. You also have to calculate the protein they need, and they need about 5 to 5.4 grams of protein. Why? Because of sarcopenia. Sarcopenia happens dramatically in cats. This is grams of muscle, lean body mass, not just muscle. And you can see after 11 years of age, it drops off precipitously. So that same thing happens in people. Same thing happens in us as well. Really sucks. I have to work a lot harder at the gym now. So that is, whoops, go this way. Get me my cursor over here. Where are you? Why is my cursor not showing up? Oh, screw it. Okay, so we know already that cats, in order to maintain body condition with chronic kidney disease, or we need them to maintain body condition with chronic kidney disease, because otherwise they're going to die sooner. We know that. We also, as I said before, weight loss begins a lot earlier. I really need you to get over here onto this screen. You're not coming. Oh, there you are. Okay. We know the same thing is true in people. So protein restriction are across the board? No. Do all cats with kidney disease have the same pathology? No. Are they all the same stages? They are not. Do they all have identical nutritional requirements? Why would they? Might it ever be appropriate to feed a cat with renal disease a protein-enhanced diet, a recuperative diet? Probably not a growth diet because of the calcium phosphorus. A maintenance diet, a senior diet. Senior diets are designed for old fat cats, not for thin cats. If the issue is really we're wanting to control serum phosphorus, at what stage do we do that? Well, we're going to use our FGF23 if it's not elevated yet. If it's elevated, then for sure we have to, and we also want to be working with fluids to try and get that down. But we have to assess muscle condition. How else can we get our phosphorus down? We can get it down by using intestinal phosphate binders, which grab the phosphorus in the intestine so that you poop it out rather than absorb it. There are diets that have renal diets that are variably protein restricted but have more phosphorus restriction. So it is possible to do. And that's really good because if you have a cat who's really poorly muscled, then we want to give them more protein. We don't want to restrict them so much, but we still can have a chance to restrict their phosphorus levels. How can we, or maybe we feed them the renal diet and we supplement their protein because they're still not gaining their muscle back. You can give them some cooked chicken breast, which has got about 7 grams of protein for 28 grams of of cooked chicken. You can use a whey-based protein diet or protein supplement for people that's very phosphorus restricted. They aren't all. You can supplement with freeze-dried chicken or freeze-dried fish. There's some, really interesting stuff about how important phosphorus is, that it's more important than protein control in renal diets. Now, with renal diets, I'm not sure which companies you got here. I know you've got Royal Canin. There's also Hills. There's also ProPlant or Purina that have staged. I don't believe that Royal Canin has staged ones yet. But does the type of phosphorus matter? There's some really interesting stuff coming out now, which shows that the type of phosphorus, whether it's organic or inorganic, may be, so what it comes from in the diet, may be really important in how much they absorb. Also, if we overly restrict, it can cause them serious problems, because then the calcium levels go up. So you do not want to let that calcium go up. So the diet choice for a cat with chronic kidney disease is going to depend on their phosphorus levels, or FGF23, their potassium levels, whether or not they're uremic, whether or not they're proteinuric. Proteinuria needs more protein rather than less in cats because they're peeing it out and they need their protein, so very different. So you have to individualize and reassess. Additionally, does protein have to be restricted in every meal or just some of them? And then energy, as I've already talked about, you have to make sure that that older thin ones need about 70 kcal again, and that's times 0.67. Remember, as I said, with the big picture, and this is what I want to come back to, is many old cats lose weight and muscle, and they have a decreased ability to digest. Many cats with chronic kidney disease are old, but they live a long time. So don't go shortening up their life expectancy by feeding them something that's going to kill them faster by making them lose muscle. Maintaining weight and condition prolongs life. We need to focus on meeting the needs of old cats rather than just the kidneys. Follow that muscle condition score. And it's more important that they eat always than what they eat, and that they eat enough. Switching them over a diet may take some negotiation. And you want to do it gradually. So you want to increase the new and decrease the old gradually, the proportions over about 6 weeks. Make them gradual. It doesn't have to be 100% of the new to be successful, of the prescription diet. If they're eating 50% prescription diet and 50% of their other diet, their previous diet, they're going to do better than if they're only eating their old diet and none of the prescription diet. And it doesn't have to be 100% of the time. We want to make sure that they have good quality of life above all. Let's tempt them with various things. Old cats prefer warmed food, we know that. And we want to not hesitate to place feeding tubes. Placing feeding tubes is super important to build up muscle and build up condition and have them live a long time. We want to be proactive. The ACVIM consensus statement from 2021 on pancreatitis says this. If appetite stimulation fails to induce adequate appetite within 48 hours, place a feeding tube. And that's a whole other presentation, again, that I don't have time for right now. Resource-wise, this is a very useful resource. The ISFM consensus guidelines on managing the inappetent hospitalized cats. It's got a nice table of which helps you know when you need to get a tube into them, but don't wait. And because I don't have time to talk about tubes, because I have 5 seconds left. Really quickly, moderate protein restriction may be useful. Hyperphosphatemia is associated with progression. We don't really have data on this stuff for cats. We do have evidence that poor body condition and muscle condition are detrimental. You've got to individualize nutrition. Cats with chronic kidney disease are old. Cats with chronic kidney disease live a long time. Provide complete and balanced nutrition. Address the changes caused by chronic kidney disease. Make sure they have a good quality of life and enjoy their food. So with that, I'm going to stop. So much more I could talk with you about. Do we have time for some questions? You want to do the break and then questions? I'm going to go over on my other talks too. So if you've got questions, come on up here. Otherwise, it's break time. The next thing I'm going to talk FIP, and then I'm going to talk about a cat with